While the United States waits for the FDA's decision to give Pfizer COVID vaccine emergency use authorization, the wheels are already turning to roll out the vaccine almost immediately. The Pfizer plant in western Michigan says it is ready to ship 6.4 million doses within 24 hours of approval. But distributing a coronavirus vaccine needs a well-balanced effort between the vaccine makers and America's shipping giants. Joining us now to break it all down is CBS transportation correspondent Kris Van Cleave. Hi, Kris. Great to see you. So as we've been saying for a few weeks, Pfizer's coronavirus vaccine is not the easiest thing to ship and store. Can you talk to us about the coordinated efforts by Pfizer, UPS, FedEx, and other companies to distribute the vaccine? And by the way, coming at a time of year when those companies are already sort of overwhelmed with other kinds of deliveries, correct?
That's right. There is the holiday season gifts that are in the mail, all of the online shopping that folks are already doing. In fact, the shipping industry has been at sort of peak of peak since March or April. This really is going to be some of the biggest logistics challenges they've ever faced. But the companies all say they think they have the capacity to do it, and the vaccine obviously is going to take priority. The vaccine's going to move through their like express shipping, their next day air, if you will, whereas most gifts move by ground. So the hope is that the two don't have to compete for too much space. But you know, your Christmas gifts, your holiday gifts are going to be packed into the same airplanes potentially as the vaccine is here starting next week. Basically what Pfizer has done, because Pfizer operated largely outside of Operation Warp Speed, they created their own system with FedEx and UPS that basically divided the country in half. So you have UPS taking the east, FedEx taking the west. And before the vaccine actually ships, what's already happening, and you showed some video of it earlier, those boxes arriving at hospitals, those are actually the prep kits, the infrastructure, if you will, that hospitals need to administer the vaccine. Syringes, PPE, the solution that helps them get it ready for injection, right? All of that stuff is shipping out to hospitals right now. More than 150 million cases of that preparation gear. So that's already working. The next step, of course, will be the vaccine distribution. And the vaccine is very temperature sensitive. It has to be kept super cold. It will ship in basically a cold box that is packed with dry ice. But once it's inside that cold box, it's kind of like any other package. They can just load it into a FedEx or a UPS truck, drive it to their distribution facility, put it on a plane, and get it into their network and on its way. And at that point, it sort of becomes a high-value cargo, but it's cargo to some extent when you're shipping it next day air.
Right. And Kris, what are some of the major concerns with the distribution plan that you've heard expressed, and how are those concerns being addressed?
Well, certainly the challenge with the Pfizer vaccine is keeping it cold. So these packages are going to be receiving almost real-time monitoring of both temperature and location so that they know that things are staying the temperature they're going to need to stay. They're going to get loaded into a truck from the Pfizer plant. It's going to get flown likely to Memphis or Louisville, where the two companies have their sort of world headquarters. We know UPS has a large freezer farm in Louisville that can store items in super low temperatures. So any vaccine that needs to stay in Louisville and isn't getting immediately onto a plane will go into that freezer farm. Once it delivers the next day, UPS will follow up with a shipment of dry ice to anyone in the country that has received the vaccine. UPS is making its own dry ice. That allows you to keep the vaccine super cold inside that cold box. And in fact, UPS has said they have the ability now to ship super low temperature freezers, basically, to facilities that don't have the technology on hand. So it is possible that UPS could bring you not only your infrastructure to provide the vaccine, bring you the vaccine, the dry ice, and even the freezer to keep it in right now.
All right, it's a complicated process, but one that we hope everyone can carry off without a hitch. Kris Van Cleave, thank you so much for joining us.
Sure thing.